When I was 18, I was diagnosed with polycystic ovarian syndrome, or PCOS. And more women, I feel like, are having that diagnosis now. A lot of women have irregular periods and they are wondering why. And when they actually get a diagnosis, so many times it comes back as PCOS. So it's becoming so much more common. And when I was 18 and diagnosed with it, I didn't really know what it was. It still is kind of an umbrella term for a lot of things. But I wanted to educate you guys on just what is PCOS in very, very much layman's terms. Welcome to the Truth and Fertility Podcast. My name is Haley and I am your host. I work at an OBGYN clinic where I teach women and couples how to chart their cycles so they can either achieve or avoid pregnancy and also to manage their fertility. I have a huge passion to teach women and couples about the beauty of their fertility and how the pill is never the answer to women's health. There's a lot of good and not so good information out there about fertility. And so my goal with this podcast is to help you sort out the truth from the weeds. I want to teach you how to chart your cycle and to reach your family planning goals while also even possibly locating hormonal imbalances and to receive proper treatment. I want to help you get in the best hands that you can with the best doctors that you can to reach optimal reproductive health. So if you're ready to get on this journey with me to learn more about your reproductive system, how it was created, and how it should be working, and the best medicine in order to make it work if it is not, you are in the right place. I pray that this blesses you, so let's get to it. The scary part of it is that I was actually lucky to even have that diagnosis. So back when I was 16 years old, I had my period for a few years at that point, and it never really regulated out. I was always irregular, and I went to the doctor for it. And what happens to a 16-year-old when she goes to the doctor and says that she has irregular periods? She gets put on the pill, right? And for me, I have a whole podcast on my story of, finding health in my fertility and all of that. So I will link that in the show notes below to kind of, if you want to hear the full story. But just to give you a snapshot of it, I was only on the pill for about 2 months because it made me super, super moody, which it does for a lot of women. And so I got off of it and I just kind of lived with the irregular cycles for the next 2 years or so. When I was 18, I came across some information about a doctor's office, an OBGYN clinic near where I lived that did not prescribe birth control. And they actually taught their clients how to chart their cycles as a first step towards diagnosis, because so many things you can see on a fertility chart alone that show hormonal imbalances. And with PCOS, very often there are hormonal imbalances that accompany that. So without actually having charted my cycle, learning how to read my charts and seeing a doctor who knew how to interpret my charts, I would have never had that proper diagnosis. When I was 16, there was no blood work, there was no ultrasound, there was nothing except, here's the pill. That does nothing to help it. It actually could make it worse over time because PCOS, if it's not resolved quickly, if it's not resolved right away, it does oftentimes get worse over time. And so really what the pill is doing is just placing a Band-Aid on the issue. Sure, you might be kind of masking the symptoms, but we're not actually getting to the bottom of what actually is causing your irregular cycles. And in this case, for me, it was PCOS. And so had I stayed on the pill, I would have never had that diagnosis. And actually, it's estimated that 70% of women who have PCOS are not properly diagnosed. There can be different symptoms and different things that are going on with the woman, but for the most part, a lot of it is estrogen dominance, too much estrogen. And we know that there's more and more estrogen in our water. There's estrogens even in plastic. I could go on and on about that, but we are just, in our culture, we are just so much more exposed to these estrogens that can cause these sort of reproductive disorders, and in this case, PCOS. So had I stayed on the pill, I would have never been diagnosed with it. And so we know that so many women are not being properly diagnosed. Almost up to what is estimated as 70% of women are not being properly diagnosed with PCOS. And if they're not being properly diagnosed, that means that it's probably getting worse as time goes on. And the pill isn't fixing anything. And so PCOS is a very, very common reason for women who are struggling with infertility. And so, sure, as a 16-year-old, I wasn't worried about getting pregnant at that time in my life, but I wanted to be a mom down the road. And had I not had that proper diagnosis, had I stayed on the pill for years and years and years, my husband and I, like, hands down, we would have had an infertility struggle, like, hands down. And so without that proper diagnosis and then treatment, the reason why you need a proper diagnosis is because that's what leads to proper treatment of the disease, right? So yeah, so I wouldn't have my kids without having that proper diagnosis, because with the diagnosis, I was able to find treatment. Okay, with all of that said, I know I kind of got on a soapbox for a minute, but I want to explain to you guys, okay, what actually is PCOS, polycystic ovarian syndrome? Because if so many women, more and more women are getting it and should be properly diagnosed with it, like, what actually is it, right? Okay, so here's where we get into the nuts and bolts. So usually with PCOS, a woman will have enlarged ovaries. And the ovaries on the outside, a healthy looking ovary is going to actually be kind of bumpy on the outside. With polycystic ovaries, oftentimes the ovary kind of looks like it has saran wrap over it. It's very smooth on the outside. And now, so on a physical level, that's kind of what's going on there. On a hormonal level, oftentimes a woman will be producing too many androgens, which is what a testosterone is. So she has hypertestosterone. And then she probably also has too much insulin. And so with these excess of hormones, and also too, like I mentioned earlier, probably too much estrogen. And so with these excess of hormones, what it can happen is it can disrupt ovulation. So in a normal cycle, what we want to happen is the woman has her period, right? The first day of bright red blood flow is the first day of her cycle. And then the last day of her cycle is the day before her next period. And so what we usually want to see is about, a 30-ish day cycle, a monthly cycle, and ovulation happening in the middle of that. Right? Usually around day 14, 15, 16 is when we want to see ovulation. Now, that's a very typical cycle. That's not to say that it's atypical for a woman to have, a 26-day cycle or a 35-day cycle. Like, those are fine too, but I'm just giving you a very generalized idea. Ovulation would want to be happening, about 2 weeks before your next period. And so with these excess of hormones, what can happen is it actually disrupts that process. So what even is the process of ovulation? So there's different hormones that are involved in that process. The first hormone that kind of takes over at the very beginning is called FSH, or follicle stimulating hormone. And it does exactly what it says it does. So within the woman's ovary, she has all of the eggs that she will ever have. A woman's body doesn't keep creating more eggs, whereas a man's body keeps creating more sperm, right? So men are always fertile. Women, however, are not always fertile, right? We only have really around the time of ovulation is when we're truly fertile and when a pregnancy could occur. And so with FSH, that hormone is stimulating a few follicles or a few eggs in the ovary. And so a few will be chosen each cycle and they'll start to mature. Okay, and that's what the FSH does. So there's a follicle that grows around those eggs. And so they start to mature, they start to get bigger. Now, usually what happens is one of those chosen eggs becomes the most dominant, and that's the one that's actually released at ovulation. So ovulation is when the follicle will rupture and the egg is then released from the ovary, or released from the follicle, which is then released from the ovary. And so what's happening oftentimes with PCOS is that though a few follicles are starting to mature with that FSH, right, the follicle stimulating hormone, but none of them are actually becoming so dominant to be the one to ovulate. So oftentimes women will have, if a woman with PCOS were to have an ultrasound, and this is what my ovaries looked like too, her ovaries might look like they have a string of pearls within them. And those string of pearls are all of those little eggs that have only really half matured. Because with every cycle, there's more eggs that are being recruited to start to mature, or the follicle around the egg start to mature, but none actually becomes so dominant to actually ovulate. So oftentimes a woman with PCOS is going to struggle with infertility if she's trying to get pregnant, because she's not ovulating. Or if she is ovulating, it's not happening regularly, or it might not be a strong ovulation either. And so these can pose issues for women who are wanting to get pregnant. Now, to kind of get back on my soapbox just for a minute, this is why it is so important for women to be diagnosed at a younger age. Because if we're not treating 16, 17, 18, 19-year-olds who do have PCOS, if we're just slapping the pill on them, then they get to a point where they want to get married, they want to have babies, and then all of a sudden they can't, and they don't know why. And at that point is when they start going through this whole infertility journey. When really, if we wouldn't have given her the pill in the first place, and we would have actually at age 16 done blood work, done an ultrasound, saw that she had those polycystic ovaries and treated them right then and there, then we would have gotten her to a place where her fertility is healthy. Just for the fact that if something is broken, we want to fix it, right? In medicine, if something is sick, we want to heal it. So we should be thinking that way with the reproductive system, even for these young single women who are not interested in getting pregnant. It's even just for the sake of their health, for the sake of regulating their hormones to be the way that they were created to be, in the way that they should ebb and flow those hormones, right? So if we're able to start treating women younger and younger, hopefully by the time that they do get married and do want to have babies, they don't have to go through that infertility journey. So anyways, I'll get back off my soapbox. So some things that are really common symptoms because of what is happening here with the cycle is a woman is going to have irregular cycles. Like I said, right? Her period is not going to come very regularly because a period is reliant on ovulation. So when ovulation happens, that kind of kickstarts the hormones to say, okay, we might be pregnant, we might not be pregnant, we're not quite sure yet. Every cycle, the woman's body after ovulation is going to pretend that she is pregnant, because it takes the body about 2 weeks to recognize whether the body is pregnant or not. So if the body is pregnant, then the body says, okay, we are not going to have a period, because the period, the bleeding, is the uterine lining. So there's a lining inside of the uterus, and that is a bunch of blood cells, right? And that, if a woman is pregnant, that is where that new life is going to implant. It's going to implant within that uterine lining, within that bleeding. And so if the woman's body recognizes that she is pregnant, then she needs to hold on to that uterine lining, because that's where that new life is going to implant and get its nutrients from. Now, if a woman's body recognizes, okay, I'm not pregnant, I don't need to hold on to this uterine lining anymore, the hormones drop and it sheds, and that's what her period is, right? So a woman's period is reliant on ovulation. It's not the other way around. A lot of times women think that the main event of their cycle is a period because that's the most obvious event. But really, it is ovulation. If a woman is not ovulating regularly, then she's not going to have a regular period. And it usually takes, again, like I said, with ovulation, it takes the body about 2 weeks to recognize whether she's pregnant or not. And so if she's not, then she'll have her period about 2 weeks later. So with a woman who's not ovulating regularly, she's not going to be regularly having her period either. Now, when I'm talking about a period here, I'm talking about a true period. A true period follows ovulation. Now, something that can happen with women with PCOS who have these long and irregular cycles is that because the cycle is so long, the uterine lining keeps building up, right? It doesn't just stop building, it keeps building up and it keeps getting thicker. Now, it may get to a point where the uterine lining is so thick and the woman has not ovulated yet that it just can't hold on to that uterine lining anymore. And again, the uterine lining is a bunch of blood cells. And so what can happen is what's called this breakthrough bleeding. So a woman might have these episodes of what she may consider is a period, but oftentimes it might even look different. It might be lighter. It might be for a longer or shorter amount of time. It might even be heavier than her regular period. But she's having these kind of breakthrough bleeding episodes that are not a true period because they're not following ovulation, right? It's just breakthrough bleeding because the uterus can't hold on to that uterine lining anymore. And so it starts to kind of shed just because of the heaviness and the thickness of it. Now, with all of this being said, this may or may not be happening to a woman with PCOS. This was my experience with PCOS, but PCOS is an umbrella term for a lot of different things. At the clinic I work at, there are some women who have PCOS who have what looks to be very regular cycles, right? So it's not kind of a one size fits all, but this is my experience is a very common experience for women who have PCOS. So I'm just kind of drawing from my own experience. Now, also with the ovaries being enlarged, again, most women have this with PCOS, not all, but most have enlarged ovaries. Now, the hormone estrogen is produced from the ovaries. And so if the ovary is enlarged, then in theory, what's happening is it is producing too much estrogen. So all of that has to do with the cycle, right? That may be what's going on with the woman's cycle, why she's having irregular cycles, irregular bleeding when she has PCOS. Now, there are some other kind of more outward symptoms of women who have PCOS. So some more common ones would be acne, excess of hair. So if she's growing any coarse hair like around her face, that's a very common symptom as well. Weight gain. And then oftentimes too in the ovaries, there's also these fluid-filled cysts. And that's where we get the term polycystic ovarian syndrome. Now, what's interesting though with a diagnosis, and that currently when a doctor is diagnosing for PCOS, a woman usually needs 2 out of these 3 things to be properly diagnosed with PCOS. So the first thing is hyperandrogenism. And so again, that's too much androgens, too much testosterone, and that can be seen with blood work. The second would be irregular cycles, that either a woman just knows she has irregular cycles, or if she starts charting, we can see some irregularities in her cycle charting patterns. The third would be actually polycystic ovaries, where the woman has cysts on her ovaries, and that can be seen on an ultrasound. So that's why with proper diagnosis, a woman truly needs blood work and an ultrasound to be properly diagnosed. So what's interesting though is that 1/3 of PCOS patients actually don't have polycystic ovaries. They don't have cysts on their ovaries, but they have those other signs and symptoms that really lead and point to PCOS. So that's why PCOS is much more of an umbrella term for a lot of these things. So proper diagnosis, if a woman gets properly diagnosed, right? And again, 70% of women are not properly diagnosed because they are just given the pill. So we really need to start taking a look at blood work, ultrasound, being able to properly diagnose and then properly treat. The pill is not proper treatment because it's not actually getting to the root cause of what is going on. It's not getting to the root cause of healing that PCOS. It's just masking the symptoms. Okay, so let's get into treatment then. What kinds of treatments are available for women who have PCOS? So the first line of treatment usually is some sort of lifestyle modification. So diet. Diet is super important when you have PCOS. Really just for, everybody, it is important to have a healthy diet, but especially for women with PCOS, it's low carbs, low sugar. That actually, for me, is what that was the game changer. I tried medication after medication after medication, increasing medication. Like I tried so many different medications and my body just didn't respond well to any of them. But when I finally changed my diet, I kind of went opposite. You should really try to do lifestyle changes before you go to medicine or surgery, right? But sometimes medicine is just easier than changing your lifestyle or changing your diet. So mine was kind of flipped, but lifestyle modification is super important. Making sure that you're eating healthy. And really what I did, I didn't do like any sort of crazy like keto, paleo. I didn't do any of that. I just started eating just plainly healthier. I started getting more fresh veggies and fresh fruit and not the pre-packaged, pre-made stuff, right? I stopped eating so many like snacky things, so many processed foods, really just trying to find some sort of moderation with those things. And if you're really on a health journey or you're struggling with infertility and you have not tried I call it an intense diet because changing your diet is not easy, right? It's always intense. It's always work, but just eating healthier foods and skipping the dessert, that even in and of itself can be really helpful. Okay. Now, what if a woman needs more than that? Because some women do truly need more than that. Well, then we get into different medications. So one of the first medications that I was on for a while, my body did not respond well to this, but I do also have friends that also have PCOS and they have been on this medication and it works really well for them. This medication is called metformin. This is a very common medication for people with diabetes to actually take because it helps to lower the androgen levels and improve insulin resistance. And oftentimes with diabetes, there's also an issue with that insulin resistance as well. So metformin is a very common medication to take for helping improve that insulin resistance because that can be a symptom of PCOS as well. Myo-inositol is another supplement that can just be, you can literally order on Amazon. Myo-inositol, that also helps to manage that insulin resistance, helps with irregular cycles, manage those androgen levels. That's a supplement. Again, it's not a prescribed medication, but I do have clients that are on this and they see a lot of improvement with their cycles and just overall kind of well-being being on that medication. Now, if medication is not helpful or if those supplements are not helpful and you're still not seeing an improvement either in those symptoms or lack of quality of life or infertility, then kind of the last resort would be surgery. And hopefully surgery for any type of medical situation, surgery is the last resort, right? But sometimes it is necessary. So there is a surgery to help improve PCOS and to truly heal it, and that's called an ovarian wedge resection. So this surgery was actually done a long time ago, like decades ago, 50s and 60s, but they stopped doing it because there was a huge risk of adhesions with it. Now, there is a new form of medicine that has come out since then. It started being researched more in the 70s and 80s and is now very well researched today and is continuing to be even more researched and developed, and that is called NaPro technology. I also have a whole podcast describing what that is, so I will link that in the description below as well. But NaPro technology, it's short for natural procreative technology. And so what this is, it's a women's health science that really tries to get to the root cause of whatever is causing the woman these unwanted symptoms. That clinic that I went to as an 18-year-old and got diagnosed with PCOS, that was a naprotechnology clinic. The woman that I was working with who was helping me on my treatment journey, she was trained in naprotechnology. That same clinic that I went to as an 18-year-old is the clinic that I work at today. And so naprotechnology is transforming women's health and women's medicine because it's truly getting to the root cause of what's going on. If a doctor is trained in naprotechnology, they will not prescribe the pill because the pill is not, again, it's not fixing anything. It's just masking the symptoms. So there are surgeons that are trained in naprotechnology surgery. And so with this surgery, they brought back the ovarian wedge resection, but do it in a different way where it significantly decreases that risk of adhesions. And I actually my husband and I were starting to think about possibly me actually going through this surgery. We had our first 2 children. Our first was a little bit tricky to to conceive, but after about 7 months, we were able to conceive him. Then my second kid, my daughter, she was pretty easy to conceive. Now, my third daughter was also, again, kind of tricky. And so when we were struggling to get pregnant with our third, my husband and I were actually starting to discern this possible surgery. And one of the doctors in my clinic is a napro surgeon. They are very few and far between. So I am just very lucky to have one in my area. But we started actually thinking about this. Now, it's just kind of funny how the Lord works in that when I went to my doctor to actually tell her that, yes, we'll get on your surgery schedule, they tested my urine and it was positive for pregnancy. So that was just kind of a luck of the draw, super just, putting things in the Lord's hands, a moment of trust there. But I don't know, could be down the road that I might actually still go with that surgery. So this surgery, I actually have worked with several clients that have also had this surgery, and it does drastically improve their overall just well-being with PCOS, but it also improves their cycles. So what this surgery is basically, remember how I said that with PCOS, oftentimes women have enlarged ovaries. So what this does is it literally, the surgeon literally kind of cuts a pizza slice out of the ovary and then sutures the ovary back up to kind of just to basically make the ovary smaller. And the idea of it is that if you make the ovary smaller, then the amount of estrogen it'll reduce the amount of estrogen that's being produced. And so because with PCOS, oftentimes there's an estrogen dominance or too much estrogen. So if you shrink the ovary, the theory is that it shrinks the amount of estrogen being produced. Again, that is a very last resort, but it can be a help to couples or to women, especially couples that are wanting to get pregnant and are struggling to get pregnant because of that PCOS diagnosis. So that is PCOS in a nutshell. Very, again, layman's terms, some common signs and symptoms that can point to PCOS. So many women are being diagnosed with this now, and it's just becoming a lot more common. And so we should educate ourselves on it. We should know what it is so that we can be prepared for that treatment process. So if you are on this journey of either trying to be maybe diagnosed with PCOS, or you have PCOS and you want a proper treatment, a lot of times a doctor who is trained in naprotechnology is going to want to have you start charting your cycle, because by charting your cycle, we can truly see the ebb and flow of hormones that's going on. And there are different things that I am trained and doctors are trained to see on the chart that actually indicate possible hormonal imbalances and indicate PCOS. So if you are interested in learning how to chart your cycle, then please go to truthandfertility.com. There is a contact little button at the very top, and you can just shoot me an email and say that you are interested in learning about the process of charting. I would be happy to either talk to you on the phone or just give you some information about what the charting process looks like and to see if we would be a good fit for each other. And I'm sure that we will be. So please, again, visit truthandfertility.com to look into learning how to chart with me. Everything is virtual, so it is accessible really to anybody. So thank you guys so much for listening to this podcast this week, and I will talk to you guys again next week.